Welcome. My name is Jasmine Kamboj, and I'm a medical oncologist and hematologist in the state of Minnesota and your host for the day. Empowering Oncologists is a podcast brought to you by OncoDaily, where we will focus on day-to-day concerns of an oncologist's being and workflow, with a vision to find sustainable solutions. Before we dive in, a disclaimer. The views shared on this podcast are an individual's and in no way are contributions from any organization, institution, or guidelines. For our session today, we have Dr. Chandler Park, who is an advisory dean and clinical professor at the University of Louisville School of Medicine and has served as the president of Kentucky Society of Clinical Oncology from 1998 through 2001. When not working, Dr. Park's interests lay in travel, especially using credit card points for hotels and airlines like we all do, meeting new people, and learning more about motorcycles. We will share some very adventurous secrets of Dr. Park's life towards the end of the show. Dr. Park, welcome and thank you for being here.
Oh, thank you so much for having me, Jasmine. It's an honor and pleasure to be with you. And, first of all, I want to thank you for everything you do in community oncology and winning the Yvonne Award at ASCO and being there when you received your award and had your family there. It would just give me such a warm feeling in my heart. So congratulations for everything you do. And thank you for what you do for the community oncology and throughout ASCO and everybody and, all the different people in our community.
Thank you so much. Thank you so much, Chandler. I really appreciate that. Thank you. Tell us about your journey. I know it's an elaborate and very fun process and life that you've been through. Please share some of the details with us.
Yeah, I'm very fortunate. Everything that I do is because of my mother. And, at the time when I was a child, I thought to myself, why is my mom being so hard on me? But I think it was in her nature, being Asian, the tiger mom mentality that they want what's best for us, and so they really instilled work ethic and education and studying. But by going through the whole process, it allowed me when I went off to college to kind of find what I like, find what I enjoy. And so all through kindergarten to 12th grade, because even though I was born in Seoul, South Korea, we moved to Kentucky and I grew there and just was very studious. But on the other hand, my mom and dad, even though they lived very comfortably, as soon as I turned 16, they looked at me and said, we want you to get a job. And I'm thinking to myself, I'm studying. What do you mean get a job? I learned work-life balance, and I can't thank my mom so much for my formative years all through kindergarten to high school.
Oh, that's so sweet. Dr. Park, you got involved with the State Society and you've been the president of Kentucky State Society. Tell us, how did you roll into that role, and how was your experience as through your presidential years?
Yeah, great question. Before I get to that, I want to kind of talk about how I became, the Kentucky ASCO president and so much about the whole process. So, I was very fortunate that, when I went off to college, I had an Air Force ROTC scholarship. And at the time, when I watched the movie Top Gun, like Tom Cruise, he was like the coolest person that I've ever seen on TV. And I'm like, I want to be a Navy fighter pilot or an Air Force pilot. And so
How old were you at the time?
This was around in high school. And so then I applied for the Air Force ROTC scholarship, and I got that scholarship, and I ended up at the University of Illinois. But at the time, they wouldn't allow me to change corrective vision to be a pilot. And so then that was like the first thing in my mind. I thought to myself, I got to be true to myself, right? If I can't be a pilot, I got to find something else that I really enjoy. And so I dropped the Air Force scholarship. I told my mom and dad, and you know how that is. Whenever you disappoint your parents, it can be hard.
It is hard.
I know I had to come up with a plan. And so I went to the student facility and found a job that paid the highest. And that was like a certified nursing assistant. And so I started working at the local hospital And I tell
Uh-huh.
you, I loved it. Like just being in healthcare, I didn't know anything, but just being there by the patients, seeing the doctors and the nurses, and it just gave me this, this gust of air, this wind to make me realize that I wanted to become a physician. And so
Oh.
after that, I've graduated biomedical engineering at the University of Illinois and
Mm-hmm.
biochemistry. I went
Mm-hmm.
back to Kentucky at the University of
Mm-hmm.
Louisville to go to
Mm-hmm.
medical school. And I also
Mm-hmm.
was very interested in the whole research and also PhD. So I decided to
Mm-hmm.
do like a research MD program. So I ended up with a master's in science degree in biophysics and also an MD. And so this is something that I kind of was very fortunate to have a lot of great mentors. And at the time, I learned about a lot about research. And so during med school, I loved everything. I enjoyed talking to everybody, was always studying like you and I, studying on the weekends. I just
Mm-hmm.
couldn't pick one field. And so I decided to
Right.
go into radiology. And when I was in
Mm-hmm.
radiology, it was
Mm-hmm.
magical. I loved the science. I loved
Mm-hmm.
being at the critical point of decisions for patient care. But
Mm-hmm.
I've
Mm-hmm.
already done 1 year as an intern. Because being a radiology resident, you have to do 1 year of internship. And I have
Yeah.
no idea. Those
Mm-hmm.
80-hour work weeks, quote unquote, even though we work in
Mm-hmm.
more than 80 hours, I
Yeah.
learned the continuity of patient care is what I love the most. And
Yes.
so it just kind of grew inside me. Like I
Mm-hmm.
had to
Mm-hmm.
be myself, to die be truth by self, trust your gut. And then I switched out of radiology after 4 years. And then I thought to myself, what do I want to do, Jasmine? And I just loved the tumor board. I remember Larry Einhorn and the oncologists, they became my Tom Cruise. They became my North Point. This is who I wanted to become, And then I started studying with Dr. Einhorn, doing research. And that's when I realized my true path. I wanted a medical oncology. And so then I went into medical oncology, did research, and I'm just so lucky. But then I realized that during the whole process, as a
Mm-hmm.
medical oncologist, it's not just
Mm-hmm.
about me, but also the community and also
Mm-hmm.
the patients. And so I started learning about the different state societies. And so
Mm-hmm.
I remember the very first invitation I had. It was in
Mm-hmm.
Frankfort, Kentucky, which is the capital of Kentucky. Not Louisville
Mm-hmm.
or Lexington, but it's Frankfort.
Yeah.
I showed
Yeah.
up for the very first meeting, Jasmine, and there were
Mm-hmm.
four people there. Me,
Wow.
the
Mm-hmm.
executive secretary, and two Merck reps. And I said,
Yeah.
"Where's everybody at?" And they're like, "That's everybody." And that's when I realized that I had to
Mhm.
grow this program. And so at
Right.
the time, I was very, very good at like meeting with people and connecting. And so I just
Right.
called my friends at different institutions, University of
Mm-hmm.
Kentucky, University of
Mm-hmm.
Louisville, all the top
Mm-hmm.
community hospitals in Kentucky. And I
Mm-hmm.
said, let's build the society up. And I had to find win-win-wins, Jasmine, because everybody is so busy. But I'm happy to report the State Society is doing really well now. We have over 200 members. It has to do with the people that work so hard.
Absolutely. Well, that is such an energetic story. Thank you, Chandler, for sharing that. May I ask you a question?
Yes.
So, when you showed up to your state society's meeting and there were only four people there, including yourself, at what stage in your career were you at the time?
This was like maybe 5 years into practice. So,
Okay.
I was kind of new. I think most of
So-
the other people at the time, I think
Yeah.
around this time, I think Jasmine is a lot of
Mm-hmm.
the state societies were very
Mm-hmm.
popular, in my opinion, because of a lot
Mm-hmm.
of, how do I say it, community practices that were not
Mm-hmm.
hospital based. But I don't know
Right.
exactly when. You know better than I do, Jasmine. It's something I would ask you.
Mm-hmm.
But like then, in a lot of the
Mm-hmm.
states, it
Mm-hmm.
shifted towards hospital-based oncology groups. And so
Mm.
then some of the things that kind of brought the fabric together, such as coding and CPT, it changed. And that's when I realized we have to find something, a common fabric for everybody. And that's when I realized medical education and clinical research.
That is such an important learning point because we oftentimes feel that as early career oncologists, we cannot make an impact, but you were making an impact as an early career oncologist, right? So we just have to find that niche and where we can have the most impact. That is beautiful. Thank you, Chandler. So you already kind of alluded to this, I'll probably ask you again, how crucial do you think building relationships and building a network is for anybody's career?
Oh, it's the most important. I think one thing about oncologists is we can't be silos. We all want to help our patients. And whenever we help our patients, just imagine in a given day how many people we have to talk to. We have to call the radiologist to look at the scan. Is it greater than 20% on the rhesus, right? They may not know that. We just have to put that on their mind, right? Because that would discontinue treatment right there, as opposed to super progression on immunotherapy. We have to call the pathologist and say, okay, this breast tissue, is it ER 10%, ER 5%? Like, so we constantly have to build relationships. And I feel like everybody that's in healthcare want to help, but we also want to be mindful of what they're going through. They're extremely busy. So I try to put myself in the other people's shoes, Jasmine. It's like, okay, here's Chandler. He wants to help his patients. I'm extremely busy. What can I do to help him? And so I'm very mindful. I want to do it in a very small, bite-sized, text me when you get a chance, right? Instead of calling them, because if I call one of my friends for help, they might be busy seeing somebody, right? And so just be aware of what other people's needs are, but then also truly engaging with people every time you see them, right? Like Jasmine, just like you and I do, like when we meet our friends and colleagues at ASCO or different meetings, like, how's everything going? How's your family? Any new book or research? I've noticed you did XYZ. I think that's what deepens relationships. True, genuine concern. Does that make sense?
It totally makes sense. And it is so important. Actually, one of the reasons why we structured this podcast the way we structured it, like, we tried to put in as much thought as we could, is just to bring those soft points, right? We are always so factual and so like go, go, go and so project oriented that I think somewhere deep down we are missing that soft connection with each other, which is actually the humane part of our relationships, right? And so what you said is so important, Chandler, that we have to bring that culture back, just the culture of being human, being a friend, being a person. And all our families and all that we do besides work is what makes us human too, right? So, and by the way, we are very fortunate to, I think, be in the most humanistic work that there can be, right? So we're all privileged that way, but we still should have our, we should discuss and we should talk about our families, and I think those are really important points to deepen our relationships with colleagues and friends. Chandler, you have been very engaged with the GU clinical trials. Tell us one big win and one big challenge around running clinical trials.
Yeah, I think with clinical trials, with the next best treatment today, it really boils down to having patients have access to the best treatment that may not be FDA approved. So it requires a lot of kind of reading and saying, okay, does this clinical trial make sense here today? Or are we just enrolling clinical trials to get the numbers up for our career? And so I think the biggest challenge is to look in the mirror and say, okay, does this trial really help our patients? Is this something that's going to be transformative? And so what a good example is, like in the, in the late 90s or in the late 2019, 20, we had the VISION study with the PSMA PET, Pluvicto. Pluvicto, as everybody in the audience know, it's like an antibody drug conjugate. It's an antibody that protein binds to PSMA on the prostate cancer. And once it binds, it releases a radioisotope to kill the cancer cell. And I remember when I was looking through the manuscript and looking at the study, I'm like, this makes sense. It's a targeted medication. And so then we enrolled, like we were the third highest enrollers in the world. And we just kind of told the patients about how innovative this is and how this medication is going to go up to the top. And I'm happy to report at this year's ESMO in Berlin, this is going to be at the very first line for metastatic hormone-sensitive prostate cancer. So it's going to be very interesting to see what the response rate, but I feel like the biggest win is the new innovations and be able to help patients live longer and lower quality, in terms of better quality of life with lower toxicity. Because Pluvicto, very low toxicity compared to docetaxel.
Right. So Pluvicto is coming in first line setting then?
It's going to be called a PSMA edition. It's going to be one of the plenary sessions. It's going to be very interesting what the response rate is and
Yeah.
also the survival rate. Now, the one thing I want to share, which goes back to your second question, Jasmine, and that is, what is the biggest challenge? Now, one of the things that I'm kind of jealous of is our thoracic oncologists. I was at the World Lung Conference in Barcelona, and it was like everybody with brand new metastatic non-small cell lung cancer, right? EGFR, KRAS, HER2 mutation or amplification, ROS1. There's like 15 different treatments based on biomarkers, right? You know what I mean?
Right.
It's amazing. It's amazing. Yeah, four generations of ROS1 inhibitors. But biggest challenge for me is, and I think this is for the GU community, is can we get that same targeted precision medicine for prostate and bladder? It looks like it's coming from Adam at ESMO this year, but I feel like that's the biggest challenge.
Right. Yeah. No, that's well said. Lung cancer definitely has changed a lot, not just with the targeted, but also with the immune therapy too. Like when I was a fellow, we used to give 12 months for stage 4, and now we have like 5, 7, 8 years, of survival easily. It's mind blowing. It's positively mind blowing. Chandler, let's talk about attention spans. It is estimated that the human attention span in this day and age is around 8 seconds. Now, this might be a myth without any significant scientific proof, but it is also estimated that a goldfish's attention span is around 9 seconds. So we have successfully become worse than a goldfish in terms of our attention span. At the same time, we cannot stop learning. We have to continue to educate ourselves, keep up with the data, learn about the new innovations in science. How can we create educational platforms that cater to the rapidly evolving world of oncology and also cater to the human attention span?
Yeah. I think one of the biggest things about the iPhone 20 years ago is so innovative, having all jukebox, movies, everything on your phone, but the attention span started going down because we want instant. We want it now, right? Remember, like back in the day, like we used to have voicemail and we used to come home and say, I wonder who called me to see how I'm doing. And you push the voicemail and we had the patience to listen to 7 or 8 messages. But today, even my mom or my dad or my brother, if I don't reply back in 5 minutes, they're like, "Are you okay? Are you all right?" Because we're so used to the iPhone, right? And so the same thing translates to medical education. I feel like there's so much information there and so many options. You have to do it in a way it's like bite size. You have to do it in like maybe 3 to 5 minutes and get straight to the point. Like you and I, when we went to the CME conferences, they talk about the whole pathophysiology. And Jasmine, we're thinking, wow, we're back in med school listening to 8-hour lectures. And so like, no, we don't want that. And so I feel like medical education, you have to distill it like an espresso, right? Why does it matter? First line treatment. What is the medication? What's the side effects? So it's going to have to be bite-sized.
I think that is so well said, Chandler. And I think I'm so proud of ASCO to, create projects and efforts around creating educational platforms that cater to today's declining attention spans. Chandler, one advice you would give to yourself of 10 years ago?
Yeah, I think, Jasmine, I think most of us, I think you and I, we're just so focused on other people, whether it be our patients, because this is why we're in this field, whether it be for colleagues or whether it be ASCO. But I think the key is we got to be good to ourselves. I mean, we have to take some time, to do things that we enjoy, like our hobbies. We have to take our mind off. It's like if you have a phone and your phone charges to like 2%, you need to recharge because you just can't keep going. So what I would say, and I don't think I would follow my own advice, but I would say if you can, try to find those moments during the day or during the week where you can be good to yourself. Take some time off. Do some relaxing things. Do some fun things.
Yeah, no, that's well said. Yeah, we try and travel as much as we can. I do have to get better at protecting my time though. Like we have this thing, like we'll watch a show or something every day as a family, and usually unless I'm on call or one of us is out of the house or out of town, like my husband travels a lot too, I would not keep my phone on me, and I would not have my son keep his phone on him. So there will be only one phone. So we try, but I have to get better at that, Chandler. I
Yes.
do. All right, Dr. Park, a little bit of rapid fire about you. Your favorite book?
Boy, I tell you, even though I love medicine and stuff like that, but
Mhm.
I'm always curious. I'm just a naturally curious person. But like,
Mhm.
I really like The Outliers, my Malcolm Gladwell, Tipping
Yeah.
Point. The reason I like
Yeah.
Malcolm Gladwell,
Uh-huh.
the Outliers is, I think it gives me gratitude because so much of us we're just very lucky to where we are right now, and it's not just innate knowledge or innate ability, but it's just that unique opportunities that we've had, like you and I and others, where we're so fortunate to have mentors
Right.
and just realizing that
Mhm.
nobody could do it by themselves. And so
Absolutely.
Outliers talks about these qualities that make people quote unquote successful. And
Mhm.
two is, when you and I growing up in maybe in a certain household, me especially, very strict at the time, it's
Mhm.
like, at
Mhm.
the time I didn't realize that she was
Yeah.
instilling, like discipline and work
Mhm.
ethic. And so
Mhm.
they talk about like discipline and work ethic in this book. Also the law
Mhm.
of 10,000 hours. I remember when I
Mhm.
was in residency, I'm like, why am I working over 80 hours a week? But to be
Right.
good at something, you need over 80 hours in something.
Right.
I mean,
Right.
10,000 hours. And then
Right.
three, it really boils down to connectivity. I mean, I talk to the second year med students every month, and I said, you need like the four A's. And I think it's kind of very simple but it's four A's. Like all through med school, all through residency is all about aptitude. You have to have aptitude. You have to keep up with the information. And the key there is to find the right specialty for you because you're going to put a lot more work into it than you think. And the only way
Yes.
to do that is if you really enjoy what you read and do really enjoy what you do. Like when I was in radiology residency, I loved it.
Mhm.
I remember my
Mhm.
program director said, okay, I
Mhm.
want you to be the
Mhm.
chief resident. But deep
Mhm.
inside, I
Mhm.
realized that wasn't who I
Mhm.
am. And so
Mm.
aptitude, also affability, like Jasmine, you have
Mhm.
this, everybody loves you, you get connected,
Mhm.
people love you. Like you have to be able to be affable, get along with people because people send you patients if they say, I don't want to send patients to Dr. Park if the patient's going to be complaining about them when I come back to me. Like you have to have some kind of affability and then availability. Like one of the radiation oncologists said to me, he said, Chandler, do you ever go on vacation? And the answer is yeah. But the reason he doesn't know, Jasmine, because I pick up the phone. You know what I mean? I was in Japan one year with family, and it was like 1 in the morning, and he called me. And so what am I gonna do, Jasmine? Hey, John, I'm actually in visiting Kyoto with family. Hey, John, what can I help out with? Oh, okay, yeah, listen, we'll take care of it. We'll get him in right away. Right? Because if I said I'm in Japan, that's gonna be like, okay, oh, I didn't want to bother him. It makes him feel
Yeah.
bad. And
Right.
whenever a doctor calls us, it's because they need somebody, their patient needs them,
Yeah.
right? So,
Oh.
availability, and then the last thing is just attitude. Like all of
Yeah.
us, like it's not
Mhm.
easy what we do. Our patients
Right.
sometimes get the best treatment, but they don't do well. But you don't want to be like that Debbie Downer in the room because they're already going through a lot and talk about all the side effects. And I feel like that's where you and I kind of like, it's like, can we read the room? Is this
Right.
person ready to talk about the toxicities or are the tears going down? Do we need to just
Right.
sit down and hold their hand and just listen?
Mhm.
I think those
Right.
are the four things.
Yeah. No, that's beautiful. That's beautifully said. And just being human, it really boils down to just being human. Beautiful. Your favorite leader, Chandler?
Yeah, I would say, Dr. Larry Einhorn, he's such a wonderful figure. I mean, he texts me, calls me, sends me patients. He's such a renowned person in oncology. And I remember doing research with him, the amount of information that he had
Mm-hmm.
and the command that he had in the room, and also the
Mm-hmm.
genuine kindness. I mean,
Mm-hmm.
could you imagine? like being in your 80s and you still love what you do and you're still rounding on your patients. Like he's seeing a patient right now for a second line testicular cancer for autologous stem cell transplant. He rounds on my patients, Jasmine. Isn't that amazing? I mean, he just loves what he does. Such a great leader, you know?
That's spectacular. Thank you. Thank you for sharing that. Your favorite restaurant, Chandler, in Louisville?
Well, it has to be Korean restaurant, Korean barbecue. It's called Nami.
Okay.
We have a Michelin star restaurant chef.
Okay.
He's from New York City. He decided to move up shop and start here in Louisville. It's like it's one of the best restaurants, period. But Korean barbecue, it's the place to go. NAMI.
Your favorite study, non-GU study?
Yeah. So that's a great question, Jasmine. So one of the things about studies is you have to say, okay, what do I see in the future here, right? Like, how does it benefit me? 2005, Orlando, ASCO, Herceptin, Dr. Sledge from IU, I worked with him when I was like up there for a little bit, announced the very first study for the HER2 and how the transformative it is. And now, for the very first time, and this is going to be at ESMO this year, first line HER2 targeted treatment, disatumab vedotin with immune therapy for first line metastatic urothelial cancer. So that right there set the table for all of these HER2 targeted medications.
It gives me goosebumps when I talk about that 2005 presentation because I think it received standing ovation. Is that right?
Yes. Yeah. I wasn't there, but I was just kind of, when we were like in fellows and everything, we kind of learned about it. But like, I thought to myself, the era of targeted medication.
All right, Chandler, let's move into a fun fact about you. You are an adventure seeker and a thrill seeker, and you've done lots of skydiving and bungee jumping. Tell us about your experience there and what do you learn about yourself from these adventure sports?
Yeah, I think for me, I'm always looking for new things to try out. Very naturally curious person, and I remember one of my friends when I was in college. We went to Hawaii, and I thought I was going to just lay at the beach, and laying at the beach for 2-3 days is great. But then he was like, "We're going to go up to the Dole Pineapple Farm and go out see what's going on there." So we went up to the Dole Pineapple Farm, which is on the north part of the Big Island of Honolulu. And then once we were there, they're like, okay, we want to go over here to where the pilots are. Make a long story short, I realized that he didn't say, Chandler, let's go skydiving. He slowly kind of set the path. And so then I was there. They're like, okay, we have your buddy that signed you up. Okay, here's a waiver, right? So I signed the waiver. Because guys, when they hang out with other guys, they don't want to say, oh, wow, he's scared, right? So I was up there in North Honolulu or Hawaii area and just skydiving. Wow. It was so excruciating and fun. Like, imagine, have you been skydiving, Jasmine?
Yeah.
Have you ever done skydiving or no?
No,
okay.
No.
It's not what you expect.
No, I've not done skydiving. I've done parasailing and paragliding.
Oh, parasailing and paragliding is fun. I love it. So when I thought for the very first time when I was going to fly off the plane like 20,000 foot up in the air with like a tandem jump, person, I thought it was going to feel like a roller coaster. When you go straight down really fast and you feel this thing in your stomach, it doesn't feel like that. Once you jump off, you have this air drag that pushes you up. And so you're like flying. So you're like flying around. And so you don't have that drop. And it's like you have this like 4 or 5 second experience. You're just flying around. It's just kind of like parasailing and paragliding. It is so fun. You can see the whole island. What did you think about parasailing and paragliding?
I have started to believe that in my former life I was a bird because because I really honestly did not realize how much I'm going to enjoy paragliding, which is what we did first. And then recently we did parasailing. My son actually pushed me into paragliding. We were in Switzerland and he was like, 8 years old? And he's like, let's do that. I'm like, are you kidding with me? Like it was just me and him. I'm like, we're not doing that. He says, no, let's do that. And we signed up for that in the night for the first class or first thing in the morning at 6 o'clock. And we did that. And as you said, Chandler, it is such a meditative experience in sky. And you see all the lakes. We were in Interlaken in Switzerland. You see
Beautiful.
all the lakes and other paragliders. And it's just like, it's very, very peaceful as opposed to what I had originally imagined. I mean, it's scary when you take the jump off the
Yes.
cliff, but that's like a second of a moment, right? But when you are up in the air, it's so peaceful. I would totally do it again.
Yes.
And actually, on that note, I also like zip lining just
Yeah,
because when
that's
you are
fun
zip
too.
lining, you're also in the air, you're just hanging off the rope, right? And it's so peaceful and you can see everything, the bird's eye view. And so I think I was a bird in my previous life because I love it so much.
I mean, I just see the way you're smiling and
Yeah.
glowing. Like, these are the things
Mhm.
that we need as physicians and
Mhm.
oncologists to take care of
Yeah,
patients because they're going through the toughest part of their life. We need to
absolutely.
re-energize ourselves. So that's what I learned from
Absolutely.
this. Like, these
Yeah.
experiences
Mhm.
re-energizes me for the tough
Right.
conversations and being human.
Absolutely. No, wonderful, wonderful. Chandler, I cannot not ask you about your other fun fact, which is that you have this tendency to run into celebrities. Tell us about that.
Yeah, I just happen to be at the wrong places at the right time. I don't know. So a buddy of mine, like he practiced there in New York, and so we were to watch LeBron James
Yes.
Cavaliers play the Brooklyn Nets there in
Wow.
Brooklyn, and I
Yes.
remember this particular time there was a bunch of
Mhm.
security, and I thought to
Mhm.
myself it must be because of LeBron James playing there, right? I
Mhm.
had no
Mhm.
clue, and so
Right.
they checked us kind of like going through TSA airport without the fast pass, and I'm thinking, are we going to get to the game? And so we finally got to the skybox because his dad had a skybox inside the Brooklyn Barclays Arena. And then about in the second quarter, I hear
Mhm.
this loud noise walking
Mhm.
around the hallway. And I'm like, what is this commotion? Right?
Mhm.
And I'm just a
Mhm.
curious person. So while
Mhm.
everybody's rooting for LeBron, I walked out and I hear all these people just walking in the hallway. And then
Mhm.
I looked to the right, and all of
Mhm.
a sudden, I
Mhm.
saw William and Kate walking right by, like right here, like 3 steps away. I was like, oh my God, I can't they're here. And so they like turned right around, and for me, I want to like stick out like a thumb, like so I just like sat there and I just like
Right.
I was like, I fit it
And
right
just to
in.
clarify, this is Prince William and Kate Middleton, right?
Right.
So,
And so then I
wow.
said, no one's going to believe this. So then what I did is I took a picture. I took one of somebody else to say, you got to take a picture for this. And so they took a
Mhm.
picture. And so I
Mhm.
have that picture.
Oh my gosh.
Yeah.
That is so
Okay.
fun.
Interesting. Because I don't think it ever
That
came
is
back
so
to America since that time.
wow. That is so fun. All right, Chandler, your last question for the day. If you were to relive your life, would you become an oncologist?
Absolutely. And in fact, I think it's so rewarding for me. It's all about being human, taking care of our patients, making their lives easier. Even
Mhm.
if we can't cure everybody, the
Mhm.
patients and the family remember you and I and the people that help them during their journey. And I think it's such an honor and privilege to be an
Mhm.
opportunity to help
Mhm.
people.
Absolutely.
And then also, even though I did engineering and I did radiology and all of this, but it's like Steve Jobs says, like in his graduation speech at Stanford at 2007, he's like, when you look at your life going forward, you can't
Mhm.
connect the dots. But when you
Mhm.
look back at all the experiences that you've done, it can
Mhm.
help people. And so for
Mhm.
me, doing the radiology residency, like I
Mhm.
look at my own PET scans. And when I have a
Right.
patient in the room, they say, you know what, Dr. Park, I have pain right here in the back. So I start looking at the scan. I look for lytic lesions in the back. So then I can send the patients for radiation because I had clinical context. And then
Mhm.
also when I was in med school doing research and getting a master's degree, that allowed me to
Mhm.
continue to do clinical research. So I think for me, for anybody else, like be true to
Mhm.
yourself, follow your gut,
Right.
be very appreciative,
Mhm.
ask for help, because that's what I always do, ask for
Mhm.
help from mentors. And I think the key is
Mhm.
continue to be good to yourself and just follow your mom's advice.
Wonderful. Well said. I will share that with my kid too. Thank you. Thank you, Dr. Park. So, three key takeaways for our audience from Dr. Park's conversation today. Do not hesitate to reach out to your circle of friends and colleagues and mentors for help. You may be surprised how many people are actually willing to help and how many tips they might have for you, which, we work really well when there is collective wisdom amongst us. So please use that network of yours. In terms of, growing and learning, I think Dr. Park said it very well. We have to go beyond our comfort zone and we have to be nice to ourselves. And these adventure sports or travel or attending a sports event or going to Hawaii with friends, it's really important even for patient care, because if we feel invigorated, we are a better human beings, we are better physicians, etc. So please invest in yourself as a person too. And last but not the least, I think it's very important that we as a community realize that with the evolving landscape of oncology drugs and innovations and science and research, I think we need to really come up with smart educational platforms as well, because our attention spans are decreasing, shorter than a goldfish's attention span. So we need to invest into that as well. Thank you to our viewers and listeners. This is Jasmine Kamboj and Dr. Chandler Park signing off on behalf of OncoDaily from our conversation on empowering oncologists. And now we have the Empowering Oncologist playlist on YouTube. Do not miss an episode and stay tuned. Thank you so much, Dr. Park.
Oh,
Thanks
thank you
to our
so
viewers.
much, Jasmine. Great job,
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.